Today, we're diving into the fascinating world of potency. Yes, potency. It sounds like a fancy word, but don't worry. I'm here to break it down for you in a way that's as easy as pie. So, what is potency, you ask? Well, imagine you have two different types of magic potions. One potion is super strong, and you only need a tiny bit to feel its effects, while the other is a bit weaker, and you need a lot more to get the same magical boost. That's potency in a nutshell. Potency refers to the amount of a drug needed to produce a specific effect. Think of it as the strength of the potion in your medicine cabinet. A powerful potion, or drug, can do wonders with just a sprinkle, while a less potent one might require a whole cupful to work its magic. Now, let's get a bit more technical. In pharmacology, we visualize potency through something called dose-response curves. Picture this: a graph that shows how the effect of a drug changes as we increase the dose. It's like a roller coaster ride. At first, as you climb higher and higher, the effects start to kick in, and you feel that exhilarating rush. But then, at a certain point, you reach the peak, the maximum effect. That's where you've hit the sweet spot. The magic number we often talk about in these curves is called the EC50, which stands for the effective concentration needed to achieve half of the maximum effect. It's like finding the perfect balance on a seesaw. Now, let's compare two different drugs to see how potency plays out in real life. Imagine we have drug A, which is super potent, and drug B, which is a bit more laid back. If we take a look at our side-by-side comparison, you'll see that drug A can achieve its desired effect with just a small dose. It's like a tiny superhero swooping in to save the day with just a pinch of power. On the other hand, drug B requires a much larger dose to reach the same level of effectiveness. It's like a friendly giant, great intentions, but it just needs a little more time to get going. Understanding potency is crucial, my friends. It helps doctors determine safe and effective dosing regimens. Imagine a doctor sitting down with a patient, discussing treatment plans. The doctor pulls out their trusty chart, showing how different potencies can affect the treatment plan. You see, the doctor explains, if we use drug A, we can achieve our goals with a smaller dose, which means fewer side effects for you. But if we go with drug B, we'll need to monitor you closely because it requires a larger dose to do the trick. It's all about finding the right fit for each individual. But wait, there's more. Potency isn't just about how strong a drug is, it's also about how it interacts with our bodies. Some drugs might be potent, but also have a higher risk of side effects, while others might be less potent, but come with a lower risk. It's like choosing between a sports car and a family sedan. The sports car is fast and flashy, but it might not be the safest choice for a family trip. The sedan, while not as exciting, gets you where you need to go without the extra thrills. And let's not forget about the role of the body in all of this. Each of us is unique, and our bodies respond differently to medications. Factors like age, weight, genetics, and even diet can all influence how a drug works. That's why doctors take such care in tailoring treatment plans to fit each individual. It's like a recipe for success. A little bit of this, a dash of that, and voila! Potency meets personalization. Now, you might be wondering how we measure potency in the lab. Scientists use a variety of methods, including animal studies and clinical trials, to determine how much of a drug is needed to produce its effects. It's a meticulous process, but it's essential for ensuring that we have safe and effective medications on the market. After all, we want our magic potions to work wonders, not cause chaos. As we wrap up our journey into the world of potency, remember this: understanding potency is key to unlocking the secrets of pharmacology. It helps us make informed decisions about medications, ensuring that we get the right dose to achieve the best results. So, the next time you hear someone talk about potency, you can nod along with confidence, knowing that you're in the know. Thank you for joining. Alpha interferon.